Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Some important one-liners. Malnutrition is considered as a form of adaptive starvation. Malnutrition considered as a form of adaptive starvation is marasmus. Proximal muscle weakness in malnutrition is due to hypophosphatemia. First line of management in malnutrition is hypoglycemia. Loss of fat from buccal pads is one of the last signs of marasmus. Fatty liver in kwashiorkor is due to reduced hepatic lipoprotein synthesis.
thank you and thank you for watching.